time once again for your capsule, your weekly capsule of health information. We call it your Healthy Dose, and we continue here as we're still in the month of August. It is World Breastfeeding Month, and the whole month of August proclaimed Breastfeeding Month by the governor of the state of Missouri. And here to tell us a little bit more about some of the programs and information that's involved with that process is Diane Bibb, clinical educator with Hannibal Regional Hospital. Thanks for coming by.
Good morning.
Appreciate it.
It's my
Good
pleasure
morning.
to be here.
Lots of attention being paid to this subject because, believe it or not, here in the 21st century, there's still some moms that don't get it.
Yeah, it's our cultural norm here in the United States really is formula feeding. People associate babies with bottles. And we're working hard to change that from a public health perspective. To promote breastfeeding because it does make such a significant difference in the health of our mothers and babies.
And that's the key there, because mommy gets a benefit, baby gets a lot of benefit.
Right, they do. Babies see significant health benefits when they're breastfed, with a reduction in asthma, diabetes, SIDS. There's a huge reduction in SIDS, and I don't think people oftentimes think about that. A reduction in gastrointestinal infections, serious lower respiratory tract infections, ear infections, and a reduction in obesity. Obesity prevention really does begin with breastfeeding.
Does baby get immunization benefits from mommy?
They do. Big immunologic protection when they're breastfed, and that's probably what leads to the protection from some of the more chronic, serious illnesses that babies are protected from. Things such as the cancers and asthma.
And childhood leukemia.
Yes.
Is also another one.
Yes.
Diane, is breastfeeding more on the increase these days? Is it something that young moms are becoming more aware of and accepting of it?
Yeah, it really is. The CDC, Center for Disease Control, currently is showing an increase in rates, and throughout the United States, about 77% of new moms are starting to breastfeed in the hospital. At Hannibal Regional Hospital, currently our statistics are showing about 80% of our moms start breastfeeding. But the real problem lies with duration. And they start out breastfeeding, but very soon run into problems, and within a few weeks to a few months no longer are breastfeeding. And that's what we're really working to change.
Well, how long should they breastfeed once they start?
We recommend that moms exclusively breastfeed their babies for the first 6 months. That means nothing else needs to be in their diet other than breast milk. And then once the baby reaches 6 months of age, they start solid foods, continue breastfeeding until the baby's at least a year old, and then continue breastfeeding beyond that as long as mom and baby want to.
So for all the moms who say, well, I'm going back to work in a couple of weeks, you've got a way around that.
Right. And that really is one of the first barriers moms run into. Either they're going back to school, they're going back to work, they have other commitments, and they think, well, I can't breastfeed and continue my other commitments. But there are fabulous pumps out there, and yes, there are ways around it.
And you can freeze it.
Yes, you can. You can refrigerate breast milk, you can freeze breast milk, and it'll keep in a deep freeze for as long as a year. So it keeps a long time, long as baby's going to need it.
As a lactation consultant, I'm sure that you find that you approach a mom who maybe her first initial experience or this topic even is brought up at the time of when she's in the hospital with the childbirth, and they may be uncomfortable, but you're able to work with them to get them to be comfortable with the whole process. And they're probably surprised at how simple it can be.
Yeah, oftentimes it works out very, very nicely in the hospital. Breastfeeding is very natural, both for mom and for baby, but it is a learned process. So both baby and mom need to learn what to do. So it takes a little bit of time. And in the beginning, we really encourage moms and babies just to be patient, to give it time. Frequently in our culture today, when moms do run into common problems that really are not that big of a problem to get over, they don't know where to get answers. And so we work hard in the hospital to provide those moms with as many resources as we can, so that when they get home, if they have questions, if they run into problems that are really pretty simply resolved, if they have the right answers, that they can get it.
Yeah, that's where it really comes in handy to be in the support group too. And you probably rely a lot on experience experienced moms who can say, yeah, I was through this as well, and here's what you have to do, because there can be pain, there can be a whole lot of things involved that make the process a little difficult at times.
Yeah, and that's exactly it. We do a breastfeeding support group every Monday at 5 p.m. and every Wednesday at 10 a.m. The support group is free. Moms don't need to register. It's down over on our unit at the hospital. And really the best thing moms get out of it is mother-to-mother support. It really helps to hear from other moms that their baby was up all night last night too, and you know, what are they doing to help get some sleep? Oftentimes they have questions. Do I have enough milk? Is baby getting enough?
Mm-hmm.
And they can get those questions answered and get reassured that everything's going very well for them and their baby.
You know, one of the things, too, when you talk about questions, I think that there's this concern. You mentioned SIDS before. People are, to some extent, some folks are afraid of sleeping with baby or maybe having baby there to nurse. What do you tell them at that point?
We really recommend that they have their baby sleep in their room with them initially, but not in their bed with them. Just by being close by in close proximity, it does help reduce SIDS if the baby's in a safe environment within mom's room.
Okay, good advice there. And this also, the issue of breastfeeding is also extended now into our area schools where there's special classes that are held, trying to make this a little bit more known.
Right. Most all of our area high schools teach child development classes, and very commonly they have the computerized babies that the students take home so that they can learn about the demands of taking care of a baby, especially when that baby's very young. And in the past, in Northeast Missouri, these babies have always come with a computerized chip, either for that student to breastfeed or to bottle feed. And they have always chosen the bottle feeding one in the schools. And so we're really encouraging schools to promote the breastfeeding chip, because what we do as we give birth to our babies and raise our children, a lot of that is influenced very early on. And we want to start influencing when they're learning about child development, that the very healthiest way for both mom and baby to feed their baby is to breastfeed. So we do have one high school in Northeast Missouri that has accepted that encouragement, and I know this semester they will have some of their students with the computerized dolls that'll be breastfeeding the babies instead of bottle feeding them.
Will they get to choose, or will it be pretty much a blind assignment?
It will be a choice.
Okay.
And I think they will educate them about it and then talk about it.
A choice. I'm sorry, go ahead.
I was going to say my daughter's actually in the class, and so she's the one encouraging them to go ahead and choose breastfeeding.
Yeah, just like breastfeeding is a choice in itself. If moms or expectant mothers are interested in breastfeeding, what do they do?
We do teach childbirth classes that talk a little bit about breastfeeding, and then we also have prenatal breastfeeding classes at the hospital. So during their pregnancy, they can attend those either on Monday nights or on Saturdays.
Okay. As a guy, I'm going to kind of work my way around this question. I have 4 children that were breastfed, and it was just a great thing that mom did that for them. What do you say to the public when they have problems with women breastfeeding, and if they do it discreetly, they, in my opinion, should be able to do it wherever they can, and because it's such a great thing. What do you say to the public to help them get over it?
Well, there are state laws in almost every state in the country now that say it is not indecent exposure. Moms should be able to breastfeed in public to promote that it is the normal way to feed a baby. It is, when you kind of look at our society, it's okay to see all the lingerie ads, the stores that sell lingerie, and see women without very much clothes on at all on billboards and magazines. But then people get upset if they see a baby breastfeeding in public when really they're not seeing anything.
That's what should be happening.
And that is normal.
Mm-hmm. Yeah. Interesting topic, but it seems to me that it's being more accepted.
Mm-hmm.
It's just a matter of educating and continuing that process. Diane, are those classes, the class schedule available online?
Yes, they are.
Okay.
They're available at Hannibal Regional Hospital. The website is hrhonline.org.
Okay,
Yes.
All right, good to know. And is it only held at the hospital?
Yes.
Okay, all right. Great information. And again, August is World Breastfeeding Month. And Diane, thank you very much for some great and valuable information.
Thank you.
Appreciate it.
This is a great thing.
Yep.
Thanks, Diane.
Diane Bibb, clinical educator with Hannibal Regional Hospital. And again, for more information, you can go online, Hannibal Regional Hospital, hrhonline.org. They, along with Hannibal Regional Medical Group, bring you each and every week your weekly capsule of health information, your healthy dose.